So the next one that I'm going to be doing now is magnesium sulfate. Magnesium sulfate is in the Lenny's textbook of page 513. This is used for, it's an anticonvulsant, but it's used specifically for prevention and treatment of preeclampsia and eclampsia. So it used to be used as a tocolytic, which means suppressing labor. It is no longer considered used for that. Instead, it offers neuroprotection to the developing fetus, is what it's been shown to do, and also to the treatment and prevention of preeclampsia and eclampsia. So it's administered as a secondary IV, and the dose is actually stated in the PowerPoint, so I'm going to state it out here. 5 to 6 milligrams, 4 to 6 grams per 100 millimeter of IV infused over 15 to 30 minutes. And then it's followed by a maintenance dose, but that's the physician's order. All right? So the nurse's job is to monitor the blood pressure whenever they're on this medication, monitor the blood pressure, the mother's blood pressure, her pulse, and her respiratory status. Blood pressure, pulse, and respiratory status, while the loading dose is given, and every 15 to 30 minutes at other times. All right, so what is the normal levels of magnesium, since that's what you're going to be monitoring since you're giving magnesium? So the normal level is 1.5 to 2 milliequivalents per liter. All right, that's normal. But what are the therapeutic doses? Because you don't want to get toxicity. So the therapeutic dose is 4 to 7 milliequivalents per liter. 4 to 7 milliequivalents per liter. Okay, so that's the therapeutic dose. So what's really important with these patients is to know the signs and symptoms of magnesium toxicity. If you see toxicity signs, you're going to have to discontinue immediately. All right, so the signs and symptoms are, you're going to see that decreased deep tendon reflexes, you're going to have your muscle weakness, your respiratory depression. Why are you going to have respiratory depression? Because your diaphragm is a muscle, and if your muscles are weak, you're not going to be able to breathe and get that adequate oxygen because of that, as an indirect relation. So your muscular depression, your oliguria, lower amounts of urine, and level of conscious will be decreased. So also other signs can be like nausea and feeling of warmth. So if it's suspected of a magnesium toxicity based on the signs and symptoms of the nurse's judgment, it should be immediately stopped and then be notifying the physician. Remember that if they have on file, because whenever the physician will order, just in case, calcium gluconate. Calcium gluconate is what you give if toxicity of magnesium toxicity is suspected. All right, so contraindicated for who? Patients who have myasthenia gravis, which is a muscle disorder, will be contraindicated because they already have a muscle disorder, and respiratory depression from that diaphragm weakness is very at risk for respiratory arrest. Renal failure. Why renal failure? Because you're already retaining too much of your electrolytes, and so you can have excessive magnesium in your body, or other electrolytes in general. Hypocalcemia. Why hypocalcemia? Because it has a complete indirect relationship. So if you have lower hypocalcemia, you're going to even have higher hold onto your magnesium levels. Also, if the mother has a child and they had this magnesium, the newborn may have signs of hypotonia that you want to monitor, and sleepiness. This can occur in the neonatal child. So if you see this and the kidneys are slow, you may need to get them on mechanical ventilation for a few days to recover from that. Because their kidneys are slow, they're not eliminating this magnesium as fast. So that's everything. Just make sure that you know your signs and symptoms of magnesium toxicity, and that if there are signs and symptoms, you give them calcium gluconate. So that's wrapping up magnesium sulfate for preeclampsia and eclampsia.